connected it.
Just a minute. It is just getting started. Okay, now it has started. Hello, everyone.
Hello, everyone. Okay, so yes, am I audible? Is the screen clear so that we can start the session? This is the skeletal muscle integrated session, and we will start this session now. So let me just check. Okay. So myself, Dr. Mona Lisa, I have done my MD Anatomy from Armed Force Medical College, Pune, and I'm here to discuss the anatomy with Dr. Deepti ma'am, the physiological
Hi.
aspect of skeletal muscle. So yes, I would like to tell Dr. Deepti ma'am to just introduce herself.
I myself, Dr. Deepti Karia. I'm an MD PhD Physiology, and I'm Associate Professor and educating MBBS and MD students, and more than 17 years of teaching experience. Now, Madam will first introduce you with the anatomy aspects of skeletal muscle. Ma'am, please.
Thank you. Thank you so much, ma'am. Okay. So before starting the session, I just want to give you the information regarding the cadaveric image MCQs, which will be taken tomorrow, and you can be present live for the session. You can use the code ANAT10 and you can be present live for the session. So the timing of the session is 1 p.m. and 2 p.m. So my dear aspirants, and this is the anatomy test series, which is going to happen on 21st Jan, 9 p.m. Exciting prizes are waiting for you. So this test will be highly beneficial. To do join this test and use the code ANAT10 to get enrolled for the test. So I would like to start with the muscle, and I would like to explain the general anatomical aspect and the general anatomy related to the muscle. So the first thing which I want to explain is the muscle has been derived from which word? Actually, in the when we are talking about when we talk about Latin word, it is mus. The word mus is called as mouse, and in Greek it is mice. So these two words are from which the word muscle has been derived. So when you will see also the entire body, which is having the skeletal muscle, which is very important for the locomotion, what you will see it is having origin and insertion. So generally what happens at the insertion point, it becomes a tendon-like. Okay, so that represents the tail of a mouse. So you can just, in the previous time, we have the concept that the muscle is quite movable, skeletal muscle, and it is derived from the word, and it means mouse. So it resembles a mouse with having a tapering end, which is called as tendon. The other important aspect is that it's a contractile tissue and it is important for locomotion. So yes. Let me just stop this and then we can go on to the next slide.
Amol Mistri, hello. Adarsh Kanojia, and please take one session on how to write answers in exams. Definitely we will take.
Just
Ma'am, pen down करिए please. Maybe.
yeah. No, it's not going onto the screen.
Just
Wait.
close that close that pen box, the whole. May I?
Yeah, you please you share the
Just
screen.
let me do. I'll share the screen.
Yeah.
Just a minute. Just okay.
Yeah. Thank you so much, Dr.
It's fine.
Deepti.
It's
So we will talk about the important features of the muscle. So three important features are associated with the skeleton muscle. It is having contractibility, and it is having excitability and elasticity. So these three terms are the general feature attached with the features of skeleton muscle. So when we stimulate the muscle, it contracts, and it is also having the feature of decreasing its length, and it can also be recoiled and retracted. So these are three important features of skeleton muscle: elasticity, contractibility, and excitability. Yeah. So moving on to the next slide.
Just a minute. Just a minute, madam. Let me erase all ink, then only we can move. Just a minute.
Yeah, sure, Dr. Deep.
Okay.
So in this diagram, as you can see here, the two diagrams has been shown. So this is actually the histological or the microscopic view of the skeletal muscle. So what you can appreciate here, the position of the nuclei is towards the periphery. So it is having multinucleated skeletal muscle feature is it is a multinucleated, having striation. The regular arrangement of actin and myosin is there. So in case of skeletal muscle, a regular striation is appearing. Nucleus is lying towards the periphery. And as you can see, the histological image, a very clear striation is visible. So whole of our body, which the muscle is attached to the bone, is called as the skeleton muscle. So we have to understand there is no problem to identify that this is a skeleton muscle when we go for macroscopic view. There is certain features which has to be known so that we can differentiate the microscopic view of skeleton, smooth, and cardiac muscle. So what is the target of today's session is to discuss the skeleton muscle. Skeleton muscle is responding to electrical stimulus, is capable of contraction, and also when we overuse it, it gets fatigued. So these are the general features. Now, the muscle of the limbs and the body wall is all considered to be skeletal muscle, which is also called as striated. And why it is called as somatic? Because it is getting innervation from somatic nerve, and it is under our will. So when I want to flex my elbow, I can flex it, I can extend it. That means it is under our will. It is not under autonomic nerve supply. So it is called as voluntary muscle. Moving to the next slide.
Just a minute.
Yeah. Now, my dear aspirants, can you appreciate in this image? Actually, the single muscle fiber has been shown. Can you see here? This is a single muscle fiber, and this is having. So I have already taken a session which I have taken previously, in which I have described the modification of deep fascia. So when we are talking about a single skeletal muscle fiber, it is getting wrapped by a deep muscle fascia that is called as endomysium. Now, thank you so much, Dr. Dipti. And you can see here that each of this muscle fiber is together formed to form the muscle fasciculus or muscle bundle. So this entire muscle bundle and fasciculus is again wrapped by a modification of deep fascia, which is called as perimysium. Okay, so the diagram is quite clear and you can appreciate it. Now, these muscle bundle will join together and will form the entire muscle, which is overlapped and covered by epimysium. So the next point which comes in your mind, that these modifications, ma'am, and these coverings are why necessary. So for example, it is giving strength to the muscle. Okay, so that means when we stand alone, we are not so strong, but for example, I will take an example here itself, like I was stuck for the internet and I was not able to move and change the slide. So Dr. Dipti has helped me. So together we were able to do that. Same thing is there when the muscle fibers, muscle bundle is together and it is having a wrapping of the deep connective tissue, it becomes more stronger. These modifications and deep fascia in between the blood vessel, the nerves, the lymphatics is also traversing. So these are three connective tissue covering for the skeletal muscle. Moving to the next.
Just a minute.
Okay. Now, as I told you that the muscle is having a belly and is also having a tapering end like a mouse, which is called as the tendon. So if you compare the fleshy part of the muscle with that of the tendinous
Madam, sorry
intersection.
to interrupt you. There is one question. Confusion between perimysium and endomysium. So
Okay,
so many comments are also there. I wanted to draw your
yeah.
attention that your students are giving good comments for you. That madam's notes are very helpful and all, and madam is so busy in teaching that yes, that's so nice of you. Okay.
Thank you, thank you for it. So yes, Savita, what happens? Okay, now if you will see a single muscle unit, that is muscle fiber. So can you please show me
Yes,
that previous slide, Dr. Dipti?
just
Thank you, Dr. So if you will see, this is a muscle fiber. Okay, muscle fiber is the structural and functional unit of muscle. Okay, so this, so what you can see, this is the muscle fiber, and it is having a wrapping of deep fascia that is called as endomysium. So single muscle fiber covered by modification fascia is called as endomysium. Now these muscle fibers will unite together to form muscle bundle. Okay, तो ये एक पेन है, ये एक पेन है, फिर ये एक पेन है. सो सारे ये क्या है, सिंगल मसल फाइबर्स. ये दो सब यूनाइट करके क्या बना, मसल bundle or fasciculus. Okay, now these muscle bundle and fasciculus will again unite to form the entire of the muscle. So these unit is having the covering of the fascia, that is of connective tissue, and that is called as endomysium covering muscle fiber, perimysium covering the entire muscle bundle, and epimysium covering the entire muscle. So is it okay? Now, my dear aspirants, now you can see, for example, you can see in this diagram, I was taking example of calf muscle. Okay, so these are the prof exam for the first year. So we are going with very primitive and the basic things which I want to explain. So what you can see here, यहाँ पे ankle joint भी shown है, and you can see a heel bone. Okay, so you can see here that tendon is getting inserted on that heel bone, that is calcaneum. So what you can appreciate, it is getting cord-like. At the inserting point, it is getting cord-like. Now, general composition जब हम देखते हैं, तो there is more of collagen fibers located here, and the term which I have used for the covering of muscle as endomysium, perimysium, and epimysium, so changes to tendinium, endotendinium, and peritendinium. Okay, sorry. So some tendons can be used for tendon transplantation also. My dear aspirants, generally what happens, we compare the blood supply of muscle with that of a tendon, it is less. So healing process is delayed in case of tendon.
madam, have some water. Huh? Hello, neat aspirant. Hello, Savita, is it fine? And Sapna, Sapna, thanks for your comment. Sapna, thank you. Be connected.
Yeah, neat aspirants. Yes, sure. No, it's not COVID. It's not COVID. It's just.
It's just because of continuous lectures and all. Madam are always busy with, so this is because of that only. Okay, not to worry, dear.
So moving to the next slide. So if the tendon is having more of collagen fiber, so healing is delayed in case of tendon as compared to the belly. Okay. So let's move on to the next slide. Thank you so much, Dr. Dipti. So now, my dear aspirants, at times what happens, the muscle get flattened. Okay, if you will see, when you are the first year aspirants and students of first year, generally the NEET PG aspirants and all must have seen the dissection already in their DH hall. Okay, so when we open up the abdominal cavity, so when we see the muscle there, we see that these muscles are flattened. कैसा है, बेडशीट की तरह flattened हो गया है. So जब muscle अभी tendon की तरह नहीं है, when we are seeing, for example, I have shown the calf muscle, there you have seen the muscle was inserting like a tendon. तो उसको क्या बोलते हैं? That insertion is in the heel bone is very tapering it. But sometimes the muscle, when they are going to the insertion point, so I'm not going into insertion and origin of the muscle, but muscles of abdomen, midline of our body, that is called as linea alba, यहाँ पे जब insert होता है तो they are flattened. Okay, so that part is given the name aponeurosis. Okay, broad sheath which is called as aponeurosis. Yeah. So you can see in the diagram also, this is external oblique muscle which is highlighted here, and it is not like a tendon, it is flattened.
Sanjay, hello.
Yeah.
Sanjay,
Sanjay Kumar. Hello, Sanjay. Hello.
Now, ma'am, so as madam explained nicely about anatomical aspects, now we'll come to physiological aspects. So that is physiological anatomy of skeletal muscle. Okay? So here, so anatomy, madam has taught very nicely some physiological aspects, functional anatomy. I will continue with you all. Okay. So here, as we have discussed this tendon, aponeurosis, madam has also nicely explained epimysium, endomysium, and perimysium. Okay. So now, so what is the physiological part? Muscle is an excitable tissue. Like neuron, muscle is also an excitable tissue, and it generates its own action potential, and it contracts when it gets excited. Okay, so excitation followed by contraction, that is also known as excitation contraction coupling. Okay, now as the name suggests that they are attached with bones, and contraction of skeletal muscle that results in the movement of body. Okay, the skeletal muscles, they constitute about 40% of our total body mass. Okay, and functionally these muscles, they are not act as syncytium, that is they do not act as single unit. Okay, Rakesh Sharma, hello. Thanks for the comment, thanks for the compliment. Okay? So they do not act as single unit. There is lack of anatomical as well as physiological connection between this muscle fibers. Okay? Like cardiac muscles, these muscles, they don't act as single unit. You can see here different muscle fibers, they are not working like a single unit. Okay, now I'm not going in detail of this, as madam explained nicely. Endomysium, perimysium, and epimysium. Here in this diagram you can see all these three. Endomysium between the fibers, then perimysium, here fascicles, they are wrapped by perimysium, and epimysium. Okay, tendon also madam has explained nicely now, and aponeurosis also. Okay, so now we will discuss more about a muscle fiber, structure of a muscle fiber. The name muscle fiber, that is a single muscle cell. Raja Kumar, okay, fine, that is clear. That's our motive, that if you learn anatomy and physiology together, that becomes very clear for you. Okay,
Yes.
So we could achieve our motive. That's very happy for happy moment for we also. Okay, now we discuss about single muscle fiber or single muscle cell. You can see length of this single muscle fiber, that is about 1 to 40 millimeter. This is macroscopic structure. Okay, and it is cylindrical, shape is cylindrical, with a diameter from 10 to 100 micrometer. And as madam said that it is multi-nucleated cells. You can see multiple nuclei are there in single muscle fiber. Okay, and these nuclei are not in the center like other cells. They are located just beneath the sarcolemma. What is sarcolemma? That is cell membrane of skeletal muscle cell, that is sarcolemma. Okay, next terminology that you will come across in physiology as well as histology and anatomy, that is sarcoplasm, that is cytoplasm of skeletal muscle cell. Next, that is sarcotubular system. We will discuss in detail what is sarcotubular system. That is made up of your T tubules. We will discuss what is it, and L tubules. They combinedly form L tubules or sarcoplasmic reticulum. They both form sarcotubular system. They have very important role in muscle contraction. Okay. Now we discuss about structure. As most of the organelle are same, muscle, skeletal muscle is having nuclei. It is having myofibrils. What is myofibril? We will discuss. Myofibrils, it has Golgi apparatus, mitochondria, sarcoplasmic reticulum, ribosomes, plus it has glycogen and lipid droplets. These are for muscle contraction as it requires glycogen. So it has glycogen and lipid droplets too. Okay, some terminologies as we have already discussed. One is myocyte, skeletal muscle cell. Next is sarcolemma, cell membrane of skeletal muscle cell. Sarcoplasm, that is cytoplasm of skeletal muscle cell. And sarcoplasmic reticulum, that is smooth endoplasmic reticulum of skeletal muscle cell. Okay, now as we have discussed, one or more nuclei per skeletal muscle cell, which is oval or elongated in shape, and it is located just beneath the sarcolemma. You can see here, because in the center myofibrils are there, nucleus is just beneath the sarcolemma. Now, what is this myofibrils? They consist of, each muscle fiber consists of large number of myofibrils. Okay, you can see here, this is one myofibril here. Okay, one myofibril present. Okay, and this myofibril they run parallel to the entire length of muscle fiber. Okay, so they are arranged parallel. Their diameter that is 1 to 2 micrometer and length is 1 to 40 millimeter. Okay, and this myofibrils, they consist of myofilaments. Don't get confused. This is one myofibril, this one, which is having myofilaments inside here. Okay, so this myofilaments are our thick and thin filaments. Thick filament, that is also known as myosin filament, and thin one, that is actin filament. Okay, myosin filaments number, that is half than actin. About 1500 myosin filaments in one myofibril, then 3000 actin filaments are present. Okay, so because of this thick and thin filament, you can have this striations. This arrangement of thick and thin filaments, they give muscle appearance like striations. So that is known as striated muscle. That is why our skeletal muscles are striated. Okay, now next is striation of muscle fibers. Now how it looks like and which are the different striations, different bands present in the muscle. So dark band, that is, you can see here, this is dark band, A band. Why is it known as A band? Because it is anisotropic to polarized light. When polarized light passes through this band, that will be reflected to different areas. Okay, this is anisotropic. This is A band. Okay, in the center of A band, you have this H zone, which is also known as Hansen zone. Okay, here, because in this center we don't have heads of the myosin, so this is little bit lighter than other A band. Okay, next is in the center of here H zone, we have M line. This is, and this becomes prominent when your muscle contracts. Okay, because H zone disappears and this M line becomes prominent. It is in the center. Okay, then next is your I band. Here you can see this one is I band. Here you have only actin filaments. You can see here, that gives light I band, isotropic to polarized light. And in the center of I band, we have this Z line. Okay, you can see here this Z line divides your I band in two equal halves. So you can say that Z line is in the center of I band. Okay, and the distance between two Z line, as we all know, that is known as sarcomere. Okay, so this we have discussed. Light band is I band, dark is A band. You can see here this is Z disc. In between this Z disc we have sarcomere. Okay? So in sarcomere you can see there is half I band this side, half on the other side, and in the center there is A band. In the resting state, this sarcomere length is about 2.5 micrometer. Okay? And sarcomere length changes during muscle contraction. When muscle contracts, your actin filaments, they slide over the myosin filament. So what happens? Your size of your this sarcomere decreases and it becomes around 1.5 micrometer because of sliding of actin filaments. Okay, and when sarcomere is stretched, maximum stretching, this length becomes highest, that is about 3.5 micro. Okay? Then comes your sarcotubular system. As I told you, that is made up of sarcolemma. Extension of sarcolemma you can see here. These are in the form of T tubules. Sarcolemma invaginates here. You can see that is in the form of T tubules here. Okay, and along with that we have this sarcoplasmic reticulum here. This is yellow colored one. Okay, so these two, they form your sarcotubular system. Okay, now Sanjay Kumar. Okay, thank you. Thanks for the appreciation. Now,
Thank you.
what is the role of these T tubules? These T tubules are important for conduction of depolarization wave, because this depolarization wave, when it passes through this cell membrane sarcolemma, because of this T tubule only, this action potential can enter inside. Okay, so this is the role of T tubule. Now you can see here, one more thing here. You can say, you might have confusion that madam this is T transversely, but this doesn't look transversely. This is the actual picture is this one. You can see here now your T tubules, they become transverse here. Okay, and we have this sarcoplasmic reticulum. So these two, they form combinedly, they form sarcotubular system. Okay, now so this we have discussed T tubule. Another important thing, this T tubule and sarcotubular system, they are present at AI junction, at the junction of A band and I band. Okay, and in our sarcomere we have two AI junction. You can see here, suppose this is your sarcomere, you have this, these are your thin and thick filament. This is one AI junction, this is other AI junction. Okay, junction between A band and I band. So you can see here we have two sarcotubular system in one sarcomere. This is in skeletal muscle only. In cardiac muscle, one sarcotubular system per sarcomere. So this is the reason for excitability of skeletal muscle. Okay, and these T tubules, they contain extracellular fluid because they are the continuation of sarcolemma. So you can see here inside we have extracellular fluid. Okay? Next is this T tubule transverse tubular system. They have dihydropyridine receptor. You can see here. These are voltage sensor calcium channels. Means whenever action potential comes here, these channels, they get opened up. Why are they known as dihydropyridine receptors? Because they are blocked by the drug dihydropyridine. Okay, so when action potential comes, what happens? These channels, they open. Now this action potential, because of this calcium channel opening, now this action potential can enter inside, and from sarcoplasmic reticulum also there is release of calcium ions. In the sarcoplasmic reticulum, we have another calcium channels. These are not voltage gated, but this also are known as calcium channels because of this action potential they get opened up, and these are ryanodine receptors. Okay, why ryanodine receptors? Because they're stimulated by alkaloid ryanodine. Okay, so here also you can see. So this is your T tubule again, and these are your longitudinal. Okay, so what happens here when action potential comes? Calcium channels, this dihydropyridine receptors, they open and then they cause release of calcium ions from sarcoplasmic reticulum. Now this calcium ions, they bind with your troponin C, and when this calcium ions they bind with troponin C, then this troponin tropomyosin complex is removed from the actin molecule. So now actin molecules, they get free, so they can bind with the head of myosin molecule. Okay, so this way there is muscle contraction. I am not going in much detail, otherwise it becomes a lengthy topic, so I'm not going in much detail of this whole. Okay, so but just this is just a summary of your sarcotubular system. Okay, T-tubule, and these are your ryanodine receptors as well as dihydropyridine receptors. Okay, so I hand it over to madam to continue the session. Okay.
Thank you so much, Dr. Dilli. Nice explanation. I also got to revise about the physiological and in-depth knowledge. Yeah.
Thanks.
Yeah. Now let's for my anatomical view, if I want to talk about skeletal muscle, I want to explain the fiber arrangement. Okay, so it's very important when you go for your viva examination of first year MBBS prof exam, and also for your MCQ and for your next, that you should know all types of muscle fiber arrangement. Okay, so the first thing which I want to explain here is rapid. Okay, so my dear aspirants, when as I told you, जब हमने बात की थी हमारे abdomen के muscles के बारे में, that was flat leg. Okay, so these flat muscles at times interdigitate. Okay, interdigitation होता है. For example, just below the mandible here, if you will see at this location, so here also you can see mylohyoid muscle has been sewn, and you can see the mandible, just below the mandible, the two-side mylohyoid muscle is intermingling. Okay, intermingling, having more stretchability, and this arrangement is called as raphe. Okay, so example of raphe, mylohyoid muscle. I think this diagram is clear to you. Okay, so this is the mylohyoid muscle, example of raphe. Next. Thank you so much. So now I also want to tell that when we talk about the muscle, the arrangement can be oblique or in parallel or equidistant to each other. So actually, what is the function of these muscle arrangement? Why we want to study this? When we talk about, say, when we talk about the force the muscle is exerting, that is directly proportional to how many muscle fiber is constituting that whole muscle. And if we talk about the range of movement, so ज्यादा रेंज मूवमेंट किसका होगा अगर इंडिविजुअल मसल फाइबर्स के लेंथ मोर है. Okay, so 2 points have to be cleared about the muscle. One is the force and other is the range. When I'm talking about force, it is proportionate to number of muscle fibers. ठीक है, एक मसल है जिसके पास 1000 मसल फाइबर्स है एंड एक मसल है जिसके पास 500, तो किसमें ज्यादा फोर्स होगा? 1000 में. उसी तरह अगर रेंज की बात करेंगे तो जो हमारे पास जो मसल है जिसका लेंथ ज्यादा है, वी आर टॉकिंग अबाउट द लेंथ ऑफ द मसल व्हिच इज मोर. फॉर एग्जांपल, वन ऑफ द मसल इज sartorius muscle, which is lying on the anterior aspect of the thigh, which is having more of its length. So the proportion, the range of movement is proportional to the length of muscle fiber. Now, my dear aspirants, according to the arrangement of this single muscle fibers, okay, these muscle fibers can be arranged equidistant to each other, parallel, oblique, spiral, and cruciate. So for your viva examination, for your theory paper of prof exam, for your next exam, you have to identify each category of muscle along with its example. How you are going to identify? By seeing numerous of diagrams. So let's move on to the next. Yeah. So see here I have shown you the parallel fasciculi. So in this diagram, there is schematic diagram which is representing how the muscle fibers are arranged. Okay, so fasciculi or the muscle bundles which is parallel to the line of pull, then these kind of muscle is called as parallel fasciculi. The various arrangement of parallel fasciculi, it can be either quadrilateral. So what is the example of quadrilateral muscle fiber arrangement? Thyrohyoid, where it will be located in between hyoid bone and thyroid cartilage. Okay, so in the anterior aspect of the neck, we have got thyroid cartilage and we have got hyoid bone. Okay, so the interconnection, I will show you that diagrams also, don't worry. So just know the example now. Then the quadrilateral thyroid, strap like, strap का मतलब like a belt, like a belt. In common terms की बात करते हैं तो like a belt. So which muscle is like a belt or strap? Sartorius muscle. Sartorius muscle, an important muscle in the anterior aspect of thigh, which is also called as टेलर मसल. ओके, इसको क्या बोलते हैं? टेलर मसल भी कहते हैं. क्यों? क्योंकि हमारे प्रिमिटिव टाइम में जो टेलर्स थे, मींस फ्रॉम बैक, दे वर having the position of palthi and then they were doing their work. So sartorius muscle movement is like a palthi muscle. Okay, strap with tendinous intersection. Okay, six pack muscle. Okay, अभी सबको क्या चाहिए? सिक्स पैक्स चाहिए ना. तो रेक्टस एब्डोमिनस मसल है. इट इज एन एग्जांपल ऑफ पैलर मसल विच इज हैविंग इन बिटवीन टेंडिनियस इंटरसेक्शन. तो वहां पे क्या हो जाता है? सिक्स पैक, फोर पैक, टू पैक, every pack which is coming in between the tendinous intersection. So the person who is a bodybuilder, who is quite fit, you can appreciate the muscle fibers and the tendinous intersection by seeing externally the body. Generally what क्या होता है? हम skin dissect करते हैं, superficial fascia remove करते हैं, deep fascia, then we see the muscle fibers and their arrangement. But rectus abdominis muscle intersection can be visualized externally also if you are going to have a good pack muscle, six pack muscle. Okay, fusiform. Okay, fusiform means you can see here in the diagram also, it's a light you can see here it's slightly elevated. It's fusiform. Like for example, we have got here biceps. In the anterior aspect of arm we have got biceps. So you will see the belly is slightly enlarged. It is having a rounded or fusiform belly. So these pallor fasciculi is having good range of movement. It have a maximum range of movement. Range of movement is proportionate to length of muscle fiber. So that means when the muscles are arranged in the parallel group, either it can be quadrilateral, strap-like, tendinous intersection, or it is in the fusiform, it is having more range of movement. So various presentation has also been shown you. Let's move on to the next slide. Yeah. Now coming to oblique fasciculi. So what happens? यहाँ पे क्या होता है? जो muscle fibers है, they are converging at a point. Okay, so these muscle fibers are converging at one point. It can be either, yeah, thank you, Dr. B. So you can see it is fan-like or triangular, and it is converging at a point. It can either converge on sides, it can converge in midline, or there can be different shapes which is converging in the midline, or it can be having different kind of shapes like pinnet. What do you mean by the word pinnet? आपने birds के feathers देखे? Okay, so birds का feather है. If we take that feather half, अगर half of feather की बात करें तो it is unipinnet. If you complete one feather, then it is called as bipinnet. So it's very beautiful. Once we go for anatomical dissection, these things can be visualized. And if you are knowing the examples, so अभी क्या हो गए? हम सबसे पहले क्या पढ़ाई करते हैं? जनरल एनाटॉमी, जनरल बातें. सो व्हाट आई एम टॉकिंग इज जनरल एस्पेक्ट ऑफ प्रेजेंटेशन ऑफ द मसल व्हेन वी विजुअलाइज्ड इट. Now you will know the example, you will know the location, and when you will dissect and see the arrangement of muscle fibers by your own naked eye, then it will become more interesting. Okay, so we have got unipinnet. Example is flexor pollicis long. So flexor pollicis. So what do you mean by the word pollicis? Thumb. क्या? थंब है. तो थंब के पास ये वाले मसल होंगे, मींस इट्स अ मसल ऑफ अपर लिप. Bipinnet, rectus femoris. Rectus femoris. What do you mean by the word rectus? Straight femoris means pertaining to femur. So it is a muscle which is lying in anterior aspect of the thigh. So it is bipinnet. Multipinnet. Multipinnet means many feathers. So the shape of the muscle is like a many feather. It is also represented here. And we know this muscle which is overlying over the shoulder, this is deltoid muscle. So this deltoid muscle is having multipinnet presentation. To be more specific for your examination, for your next, what I would suggest that the acromial fibers of the deltoid muscle is only multipinnet. Which fibers? Acromial fibers, which is also called as the middle fibers of the deltoid muscle. Okay, so why I am telling you these points, because these are the crux point which is going to be asked in your viva and your competitive exam. The next is circumpinnet. Okay, circumpinnet का मतलब सारे जो muscle हैं, they are converging at a point. Okay, many feathers, multipinnet like a presentation is there, but all points are converging in the midline, in the center. So the example is tibialis anterior, the muscle of the leg which is lying on the anterior aspect of the leg. Range of the movement is reduced, but my dear aspirant, the power is increased. So अगर हम oblique fasciculus की बात कर रहे हैं, where the muscle fibers are converging, at that point the power is more, range is reduced as compared to the muscles which we have talked previously, that is parallel muscle fiber. So I think this basic concept is clear. Okay, for those who are present here, let's move on to the next. Okay, the next is fascicular architecture में हम spiral और twisted भी देखते हैं. When we will go in the muscles of the anterior aspect of the chest and that of the back, there is latissimus dorsi muscle, there is trapezius and pectoralis major. So spiral and twisted means the muscle will have a wide origin, and when at the insertion point their fibers at the insertion point upper fibers lower हो जाएंगे या lower fibers upper हो जाएंगे. So they are twisted in nature. If you are going to see the diagram, you will become clear with these things. So let me show you that diagram. So my dear aspirants, before that, just see the cruciate fasciculi. What do you mean by the word cruciate? The word cruciate means crisscross. Means the muscle fibers are crossing each other. So in this diagram, you can see here in the neck, can you see two bellies are crossing each other? This is the sternocleidomastoid muscle. Yeah, this one. Yeah. Thank you so much, Dr. Dipti. Yeah, thank you. This is, yeah, thank you. So yeah, so this is the sternocleidomastoid muscle, the muscle which you can also appreciate if you move on side, and the prominent muscle which is seen in the lateral aspect of the leg, that is called as sternocleidomastoid muscle. So this muscle fibers is having clavicular and sternal origin, and as you can see in the diagram, they are crossing to each other. Same way masseter muscle. So this is mandible. Just clench your teeth. Yeah, and feel that tightness. The tightness which you feel here is the masseter muscle. See here. Here also few fibers are crossing. So jahan pe bhi muscle fibers are crossing each other, it's an example of cruciate fasciculi. And actually, how they are asking this, if I see the pattern of MCQs in the previous year of NEET and that of next, in the previous year of NEET and AIIMS exam also, they have given one of the diagram. Okay. And they will just highlight it and ask you which muscle fasciculi is this, or among this, which is the example of. So you have to identify it, and these are very easy to understand. Actually, many of the students must be watching the session. They must be not seen all the muscle. Once you go for the more gross, it becomes very, very easy. Okay, so these are example of cruciate fasciculi. Moving to the next. Now, my dear aspirant, these are general terms which you have to know. Actually, I have already explained the muscle fascicular arrangement and how they are named according to that. But if you will see the muscle in our body, it is having the name, shape पे भी name है. For example, trapezius muscle of the back is trapezium, same when we join two sides, then it is called trapezius. Rhomboidus means rhomboid shape. Delta means delta shape. So these naming or nomenclature has been done according to the shape. Same way, we have got number of heads. Actually, when you will study the muscle, you have to understand the origin and the insertion point. So, अगर हमने देखा वो muscle में two origins है, so that is called as biceps. So we have got biceps brachii at the anterior aspect of the arm, triceps on the posterior aspect of the arm having three heads of origin, and same way we have got quadriceps. So my dear aspirants, जब हम thigh पढ़ेंगे, anterior aspect of the thigh, there is quadriceps femoris muscle, and actually it is having four heads. So these are, it is having four components. It is having vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris. So all these four muscles are taken together, and the name given is quadriceps femoris. Okay. Now let's talk about structure. Some of the muscle has got their name according to the structure. When you will do the dissection and you see the muscle is having tendinous like shape, and it is very cord-like, the term which is used is semi-tendinosus. When it is flattened like, it is semi-membranosus. Location. On the temporal region, here we have got a muscle which is called as temporalis. So the name is according to the location. Supraspinatus, above the spine. Attachment, according to the attachment. Stylohyoid, that means on the hyoid bone, and stelloid process of temporal. stelloid process of temporal bone. What is temporal bone? Temporal bone is the bone in which we have got petrous part, which is, what do you mean by the word petrous? Hardest structure in our body. बहुत hard होता है. उसके अंदर क्या होता है? What lies inside it? Internal ear. To protect the internal ear, it is located inside the petrous part of temporal bone. Cricothyroid, that means it is attached to two cartilages. Okay, so we know that cricoid and thyroid, these two are cartilages of the larynx. Action के according भी nomenclature होता है. Adductor long is flexor carpi and larynx. Direction of fibers, rectus, the word rectus means straight, transverse means transverse, and relative position, medial and lateral pterygoid. So these are very simple, but it's important for the first year MBBS students that you know this basic things also. So this is just like this. So in any our times, like these all words are derived from Greek and Latin words. तो उन्होंने सारे जो muscles के naming की according to this pattern. Moving to the next. Yeah. So see here, my dear. So all the things which I have explained here, you can see the different variety and the arrangement of the muscle. Like see here, the quadrilateral muscle is exactly like quadrilateral. Strap is like a belt with tendinous intersection, as you can see here. Rectus abdominis muscle, fusiform biceps, digastric having two bellies. Actually, in our neck here, in the neck, in the anterior aspect of the neck, we have got one muscle which is called as digastric muscle, which is having two bellies, anterior and posterior belly. And we have got tricipital, three-headed, we have got triangular shape, we have got crisscross shape muscle, and the masseter and sternocleidomastoid. See here, a beautiful unipinnate, half feather, a beautiful bipinnate muscle. And radial, we have got multipinnate, many feather, we have got spiral and twisted nature of the muscle fibers. Okay, so these are general arrangement or architecture of skeletal muscle, which will be nicely visualized if you go for a beautiful and good dissection. Moving to the next. Yeah, so my dear aspirants, so before that, I would like to show you, this is the muscle which is sternothyroid. Okay, the green color muscle which is shown here is sternothyroid. Okay, so the outline of the thyroid cartilage has been shown here, as you can see here in the, this is thyroid cartilage which is shown. So this is exactly the thyroid cartilage. Yeah, this is thyroid cartilage. Yeah. So you can clearly see the thyroid cartilage. And you can see lower down it is attached to the sternum. So this is example of sternothyroid muscle. So green color highlighted muscle is sternothyroid muscle. Moving to the next diagram. So yeah, see here. Can you see the other green color muscle which is kya hai appearance? Belt like hai? Is it belt like? Yes. So this is the sartorius muscle, talar muscle. Okay. So all these we have already talked about example. This is sartorius muscle. Okay. So this is sartorius muscle. Next to it, so we will see the other one. Yeah, this is the muscle which is the anterior or six-pack muscle, that is rectus abdominis muscle. Rectus abdominis muscle. So ये कौन सा muscle है? Rectus abdominis muscle. Okay, moving to the next. Biceps brachii muscle, muscle of anterior aspect of the arm. Biceps brachii muscle. Okay. Twisted muscle. So see here the view. This is the anterior and posterior view of the back. Anterior view, the muscle on the anterior aspect here in the pectoral region is pectoralis major. The muscle of the back, trapezius muscle and the latissimus dorsi. Trapezius is not shown here. Lower than, you can see this is latissimus dorsi, which is shown from the back region. Can you see here? At the insertion point, it is twisted. It is twisted. Okay. So all these you can revise it also. So the muscle direction has been shown. You can use this and you can see this video and you can revise the nature of the muscle. So you can see here again latissimus dorsi and trapezius muscle. The upper one, back muscle, the large organ is trapezius, lower is the latissimus dorsi, and you can see it is having twisted fibers. Twisted fibers are there. Yeah. Okay, so same thing, you can appreciate the muscle of the anterior aspect of the neck, sternocleidomastoid muscle having crisscross nature. Crisscross nature. Yeah, thank you so much, Dr. Okay, my dear Aspen, you can see the masseter muscle, so which is attached onto the ramus and zygote. Here also the muscle. So you can see here ramus and zygomatic arch masseter muscle is attached, which is also having crisscross nature. So all these we have already discussed the example. Just I am showing you more diagrams so that you will have a better understanding.
Issue, hello.
Yeah. Hello, issue. Now you can see here, this is how, actually one more thing which is shown here is the circular muscle. Actually, this is the opening oral cavity. Same way we have got the eye around this. So around the eye margin in this orbit, we have got circular arrangement of the muscle that is called as orbicularis oculi. Around the oral cavity, we have got orbicularis oris muscle. So these are example of circular muscle fibers. So see here altogether, the whole thing which we have already explained is showing you the different location of the muscle. Presentation.
Sorry.
Yeah.
Okay.
So I think we have done for the whole description. So I have shown you the morphological arrangement of the muscle fiber, and ma'am has given in-depth knowledge of the interior and how the T-tubules are formed, how the jet discs, what is sarcomere. So very nice. And I was also happy to revise all these things, in-depth knowledge, and I have done the whole of muscle fibers. So we will continue this session afterwards also. So before ending, I would like to thank Dr. Dipti ma'am, and also for changing the PPT and using
Oh,
the
that's
pressures.
my pleasure, ma'am. And I'm also thankful to you that I could revise anatomy along with my physiological aspects. Okay, that is very happy to be with you in this integrated session, as well as the students also. I feel that they all are getting benefited by this integrated session. Hope for the best.
That is the whole so वही हमारा output है. अगर students are getting benefit from these sessions, so we will be glad to conduct more of such sessions.
Because in new curriculum we have this kind of sessions are included. They must be included in our curriculum because we are also integrating in college. Also, we also have to integrate anatomy, physiology, and biochemistry. So that
both horizontal and vertical.
horizontal as well as vertical. So we will also try to do that vertical integration also, that is for benefit of all the students, so that they can easily come to know what is anatomy and what is physiology. And similar along with that, we can also integrate pathological aspects as well as medicine and surgical aspects too. That is definitely benefited for the students. So that is, I think, according to new MCI curriculum, this is must. So we have tried our best. Let's see.
Hope the students would like it, and if they are liking this session, we will come up with more of these integrated sessions.
Okay, so Madam has, so thank you. Thanks to all. If you like our video, like it, share with all your friends, and subscribe our channel Unacademy Future Doctors.
Thank you. Thank you, everyone. All the best, my dear aspirants. Thank you. Thank you, Dr. Dipti.
Thank you, ma'am. Thank you, Dr. Mona Lisa. I think I stopped streaming. 1 minute रुक जाइए. Streaming बंद कर दिया है.
Okay.
Not